Hello dear colleagues, how are you today? I hope you are well. Here we are going to talk about another question of cardiology. A 55-year-old carpenter presents with a history of sudden chest pain which radiates to his jaw, accompanied by shortness of breath which started 2 hours ago. It means that the patient has had MI. An ECG was done which showed a normal sinus rhythm without ST elevation, but the MI is not showing in the patient's ECG. What is the single most appropriate investigation? Okay, A. Cardiac troponins, B. Chest X-ray, C. Echocardiogram, B. Holter ECG, E. Exercise stress test. And the answer here is cardiac troponins. Here we are going to explain it. Okay. Explanation. We are suspecting a myocardial infarction in this patient. Cardiac enzymes would need to be ordered. Measurement of cardiac troponins helps to predict which patients are at risk of cardiac event and who can be safely discharged early. And this is an important point. The risk of death from an acute coronary syndrome is directly related to troponin level, and patients with no detectable troponins have a good short-term prognosis. And this is an important note. With the patients with no detectable troponins have a good short-term prognosis. Serum levels increase within 3 to 12 hours from the onset of the chest pain and peak at 24 to 48 hours and return to baseline over 5 to 14 days. And this is also important. After 2 to 3 days, when you check the patient's troponin, it can be elevated, but it must decrease to between 5 to 14 days to the normal level. Troponin levels may therefore be normal initially and should be repeated, and this one is also important when we check the patient's troponin coming with chest pain, shortness of breath. We must recheck the patient's troponin after 2 to 3 hours if in the first check it is normal. Okay, myocardial muscle creatinine kinase or CKMB is found mainly in the heart. CKMB levels increase within 3 to 12 hours of onset of chest pain, reach peak values within 24 hours and return to baseline after 48 to 72 hours. But sensitivity and specificity of CKMB is not as high as for troponin levels. That's why cardiac troponins is very important for the patient coming with chest pain with a suspicious to myocardial infarction. Here was a short explanation about the patient coming with chest pain, which cardiac troponins was important for checking. Thank you for your attention.